What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Bryan Brozy, and I'm joined by my friend and co-host Keoni Tita. Keoni, I realized again I messed it up. What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Bryan Brozy. I'm joined by my friend and co-host Keoni Tita. Keoni, how are you today?
I'm good, but I'm tired, so you have an excuse. I think we're up early this morning. So hi everybody. Thanks again for listening in with us. I think these three podcasts, part 1 through 3, this is part 3 on diabetes, are really important for everybody, because even if you don't have diabetes and you can really control your blood sugar and keep your hemoglobin A1C down, you keep your inflammation down, you reduce your risk of all kinds of chronic disease, cancer, heart disease, of course, diabetes, dementia. Today we're going to talk about,
as I'm getting more into my practice, I'm seeing it a lot more. So I'm excited to learn as well today.
Right. Yeah. I mean, I see it all the time. And most people, it seems, at least in my practice, are pre-diabetic. So that's pretty crazy. And I think those numbers are just going to get worse and worse. But anyway, hopefully this will help people prevent that from happening. So just a quick review, we went in part 1 of our series, we talked about the difference between type 1 and type 2 diabetes, type 1 diabetes being insulin dependent, type 2 diabetes typically is not, but can be if it's uncontrolled and keeps going on and progressively gets worse. And then we talked a little bit about type 3 diabetes. It's kind of a new name for Alzheimer's now. It just kind of hints at how sugar causes damage to neurological tissue like the brain, but it does it to all tissues. So we talked about how high blood sugar damages everything throughout the body and increases your risk of all types of chronic disease.
Yeah, you talked about hemoglobin A1C being like internal rusting or a
marker.
For...
And that's my favorite way to assess whether treatments are working or if diabetes is progressing, is the hemoglobin A1C. And basically what it is, it's basically is a test of how much sugar is coating your body. Specifically, that test looks at how much sugar is coating your red blood cells or hemoglobin. And it's like a measure of internal rusting. And when you have that, it creates all types of inflammation and accelerates aging. So that was pretty much part 1. Part 2, we went into ways of how to, through lifestyle and natural treatments, how to control, how to treat, how to prevent. The natural lifestyle stuff we talked about should be used in conjunction with, depending on how far along the diabetes is, with conventional treatment or prescription treatments. And specifically, we're talking about type 2 diabetes, whereas type 1 diabetes, yes, you are insulin dependent. You need to be on insulin. And with type 2 diabetes, as the disease progresses, it's harder and harder to control those blood sugar swings. So a lot of times people, one of the third tiers of treatment is to get on insulin itself and kind of make sure that you push the blood sugar out of the bloodstream and into the cells. So we're going to talk about the prescription meds on this third part. And so let's just kind of jump right in here.
We're going to hear some common names or some familiar sounds with the names of these drugs.
Right. We've hit on some of these things in the first 2 parts. So kind of the first line of treatment, and from a conventional standpoint now, is using like glucose lowering agents or oral glucose lowering agents specifically. You always want to use it in conjunction with what we talked about in the podcast before this one, on the natural treatments and lifestyle stuff that we do for diabetes. But one of the best drugs there are out there, we talked a little bit about there, it's called Metformin, and it's a very safe drug. There's even in some circles are recommending people, especially people in the anti-aging world and in research, are even recommending Metformin may be a good thing to be on low dose anyway, whether you have diabetes or not, just because of its anti-aging benefits. But metformin is actually a medicine in a class called biguanides. And basically what they do is they just help reduce glucose lowering or sugar lowering based on how they act in the liver for the most part. Metformin is actually derived from a plant called goat's rue or French lilac, and it's been used traditionally as a diabetes medication for years. And I would certainly say, I'm all about natural treatments that, definitely use French lilac, but it has a lot of other possible negative side effects. Yes, this is a natural plant that I would not recommend. I am going to talk more about some other things that I will recommend that act like metformin and can depending on how far along you are with diabetes, actually, kind of replace it before you even get there if you wanted to go that route.
Now, Keoni, I've heard I had a patient ask me about this, if they were afraid or they were asking me about being on metformin for too long. So is that anything that is in the research or is discussed? Because I really don't know anything about it.
Well, with any med, you have your advantages and disadvantages. If you're diabetic, I think metformin has a very low risk profile. Like one of the most common side effects of it is just some like digestive disturbances that kind of are transient for most people. So you can get gastrointestinal distress. Some people talk about like a metallic taste in their mouth sometimes. Sometimes you can get buildup of lactic acid in the blood, but these are really, really rare. The thing I like about metformin also is it's really not one of these meds where if you take it, you're going to have to worry about putting yourself into a low blood sugar crash or anything like that. And it seems to be really effective for really getting people's hemoglobin A1C down and kind of putting diabetes in remission when people are on it and can tolerate it. Now, your question is well understood, because one of the things that can happen with metformin when people are on it long term is they can get it increases the risk of like B vitamin 12 deficiency. And this is really interesting because if you decrease the risk of B vitamin deficiency, then now you basically increase inflammatory markers like homocysteine. Also, B12 is very important for nerve function. And a lot of people with diabetes have what's known as peripheral neuropathy, where the nerves are just angry and they get these weird, sensations in their nerves, like numbness, tingling, cold, hot feeling, and things like that. And one of the first things that we would do for that is make sure that we supplement with a B complex or even give injection of B12. So it is important, like if somebody's on it long term, I do recommend that people get testing of B12 and homocysteine and just make sure that the long-term metformin therapy is working good. Okay.
The combination of those two tests will tell you what exactly, Keoni, or it's letting you know.
So those two tests, so you test for B12, right? And
Right.
you're just going to see, well, is metformin having an effect? Are they B12 deficient? If they are, well, all we do is we give B12, either oral form or injectable form.
And metformin can just disrupt B12 regulation in some way.
Some way, yeah.
Okay.
Yeah, and I'm not exactly sure how it does this. I think it just inhibits the absorption of B12 from food and stuff.
Okay.
So over time, it can cause problems. And then homocysteine is just basically one of those. We did a podcast way back when on anti-aging tests, and this is one of the tests that I really like. Homocysteine. It's basically a test that can give you an idea of your B vitamin status, but also it's an inflammatory marker. The higher it is, the more likely you're going to have issues, with like chronic disease. Also, it in a kind of indirect way, it gives us an idea of how well your DNA is methylated, so to speak. And you really want your DNA to be methylated well. Think about it as acting like a protective barrier. So both those tests can help. Those are the main things that I would look for there. I think people just really are kind of put off by at least the group of patients that I see, you really get put off by, well, it's a prescription drug, and that's true.
Sure.
But this is the one prescription drug that I think is an excellent drug. It's my favorite prescription drug, actually, for what it does.
Uh-huh.
Because what it does is it has been shown to lower inflammation. It's been shown to lower almost all causes of, or significantly decrease risk of every type of known cancer there is. So that's really cool, right? And think about cancer, what it does. Cancer just loves having a high sugar environment. It
Mhm.
also likes having a high, once you have high sugar, you also have high insulin levels typically, and insulin is a growth factor. And whenever you have high insulin levels, you increase your cancer risk. So this goes back to anytime somebody, a diabetic, is on insulin, based on that alone, they increase their cancer risk because they're actually injecting themselves with a growth like factor. Very interesting. Also, a lot of bodybuilders out there, I don't know if they're still doing it, but at least in that world, it's based, a lot of bodybuilders would use injectable insulin. Again, it's a growth factor, so it helps muscles to grow. It works a little bit differently than an anabolic steroid, but it is anabolic.
Mhm.
So people who are not working out tend to get fatter. People who do work out can tend to put on muscles. Now, one of the things with the lifestyle stuff, we talked, pretty in depth about exercise in many of our podcasts and what it does. Well, one of the things it does here is take sugar out of the bloodstream, which is what we want to do. So that's why exercise is so important. Um, and weightlifting does that incredibly well. But any form of exercise will do that. So metformin is a really great drug because it works in so many different ways. One of its benefits, it has this ability to activate what's called AMPK, and that's a critical enzyme that is basically a key regulator of energy balance in the body. Um, and when you can regulate that nutrient sensor like that, um, everything seems to get better. So you know how we talk about magnesium, we talk about curcumin. I mean, this is it's one of those broad acting prescription meds that's derived from a natural med, goat's rue, and has less side effects than the natural form of the medication. Um, but one thing that I tell my patients are, okay, so if you don't want to do metformin, even though it has all these incredible benefits, and I tell them to, well, think about a couple other things that we would use naturally that I use in my clinic. And one of them is called Gynostemma pentaphyllum. That's an herb that I use in some natural products. It usually comes in a combination product. But again, this activates AMPK also. And another one that also seems to do that is a natural compound called berberine.
Mhm. I've
And
heard of
both
that
of
one.
right, and both of these herbal derivatives are very, very safe also. But again, it's not they you still anytime you're on any type of medication, whether natural or not, I always tell my patients it's very important because we don't have all the information. It's very important to get your annual blood work. And a lot of times with meds and natural products, you just always want to just monitor the kidney function and the liver function. So doing that, at least your annual blood work can catch that. But these two herbs here, Gynostemma pentaphyllum and berberine, which is found in a number of herbs, are very, very safe and can act like metformin. I don't want to go so far as saying it's a great replacement for metformin. I mean, clinically, I've seen it work incredibly well. Some people will combine metformin with one or two of these herbs, which is fine. I haven't seen any problem with that. There's a number of studies out there. But you're talking about with metformin, whether you use it with berberine or Gynostemma pentaphyllum, will lower hemoglobin A1C significantly and put you into remission, which if you keep that lifestyle change, that healthy lifestyle change, and your diabetes isn't too far along, you basically cured it, your type 2 diabetes. So I think those are really important things to look at to manage diabetes or to manage your pre-diabetes. I mean, if anybody's had pre-diabetic and comes in my clinic, I will at least recommend berberine. And if they are diabetic, I will always recommend metformin as a first line treatment. And of course, that all depends on, Bryan, like how far along and how high their hemoglobin A1C is, and if
Right.
they need other forms of meds that go in conjunction with this. But metformin is a very safe med. It's cheap too. I mean, it's certainly not expensive. So that's my kind of soapbox for metformin and berberine and gynostemma pentophyllum. Now there are other herbs out there that certainly can help. But those are my two main ones, and we talked a little bit about those in the previous podcast. The second class of kind of sugar lowering drugs are called alpha glucosidase inhibitors. And basically all that means is that they inhibit the enzymes that, like if you eat, well, they inhibit the enzymes that create more sugar in your body. So for example, if you eat like a piece of bread, these enzymes go to work like amylase and glucosidase, and they go to work and they break it down into glucose. And if you can inhibit that from happening, well, then you don't have a lot of glucose floating around and it just passes out through your body, right? Through your GI tract. One of them is called acarbose, and it's the most researched, widely used alpha glucosidase inhibitor. It's basically a starch blocker. It can be used in conjunction with metformin. It's an effective first-line drug for type 2 diabetes, especially if it's not controlled by diet alone. I think the two, when you use together, complement each other without a whole lot of negative side effects. Very interesting. Also, go ahead.
When Keoni, would I guess at what point do you take that next step in adding it seems like you would start with metformin, like we just discussed. It's kind of the starting point. When do you make that jump to, like you're saying, you'd be using one of these other drugs?
For me, some of it is clinical call, the art of medicine, so to speak. But typically, if they're on metformin and their lifestyle is pretty decent and they're still having some issues, I would probably jump to this. And especially if their hemoglobin A1C is not especially high or their insulin levels are really high also, I would jump to this. So we're talking about somebody with, that's diabetic that wants to try to manage it by themselves with a hemoglobin A1C, I don't know, between like 6.4 and maybe 7 something. And they're just not able to get it down with just metformin alone or with lifestyle alone. I may try this, and they're not necessarily a candidate for going into any of the injectable glucose lowering drugs.
Are you a type? Would you have to be a type 2 diabetic to, at this point, start taking things like these starch blockers?
The prescription starch blockers, absolutely.
Yeah.
But there are starch blockers that are natural, right?
Right.
One of them, and we talked about those a little bit last time. One of them is, we talked about seaweed extract acts like a starch blocker. White kidney bean extract, which you can find, these things are in supplements, also acts as a starch blocker, which is pretty amazing. There's a number of herbal products that do this. I think mulberry leaf does too. Again, the research isn't as well as acarbose, but you can certainly start with those.
Well, and that makes logical sense, right? Because a starch blocker, it just kind of goes along with what your diet is. So you can very much control that and have, versus metformin, which is a lot more really, I guess, specifically addressing the glucose levels and the production of glucose, versus this is kind of you eat a lot of glucose and it stops you from producing as much glucose from eating that much glucose.
Yeah.
Say glucose 1,000 times. But so it really just seems like you would never want to get to this step, obviously.
No, you don't. And that's why I tell my patients, like, well, here's one of the tragedies with diabetes. I mean, it's really insidious. So people don't really know. Like they may I hear this a lot. Well, I'm 50 years old now, and my eyesight is getting weird. I get blurry vision every now and then. I have ringing in my ears. I have just comes on. I just don't seem to recover as well from any workouts that I do anymore. Or, every time I eat, drink a soda, I feel awful. These are indications that you need to be tested. This is why I tell people, like, when they come into my clinic, one of the first things I do with them is like, I'm a primary care physician, but I can't be your primary care physician because I carry my license in another state, and I just deal with natural medicine. So if you don't have a primary care doc, you should get one right away. Not anybody you need to hang out with for long periods of time. It just means you just go in there, get your blood work, and if you need referrals, you get the referrals.
Right.
But even if you don't have that, you should always get annual blood work every year and just see where you are so you can monitor things. Because one of the things they always do on just regular blood work, you don't even have to run a hemoglobin A1C, is just fasting glucose. I mean, hell, you can go buy a finger stick product over the counter at the drugstore and check that. And watching that can really tell you where you're headed. Another way to know if you're headed towards diabetes for men and women, but especially for men, is if you have any bioelectric impedance machine that assesses your body fat, and it segments it to where you can see what your torso body fat is. For men, anytime your body fat in your torso is higher than your legs or your arms, you are probably pre-diabetic. So those are indications that you can manage it. If you're overweight, you're heading that way. People that work out, though, even whether they're overweight or not, really stem that off and can stave it off indefinitely, whether they're overweight or not, just based on making sure that their muscles stay sugar and insulin sensitive, which is what exercise does.
Yeah, yeah. It's a shame that those natural starch blockers that we talked about, like in the second episode,
Yeah.
and we just mentioned there, aren't more commonly known. Because if you're pre-diabetic, you're in that stage you were just talking about. Those are little things that could make the difference. Adding them to your pasta night or whatever the case may be.
Yep.
Those are things that can really make a difference at that
Huge,
time versus when you
huge,
actually have to
huge
take
difference.
one of these drugs.
It's a huge difference. And a step before even thinking about these starch blockers or amylase inhibitors is, one blunt way to inhibit all of this from happening is making sure your diet is high in fiber, and a lot of fibers like rice bran act on top of being fiber and slowing down the sugar and all that. It's multiple mechanisms. Not only they act like a starch blocker, inhibit enzymes from breaking down starch, but they also slow down just the nature of its fiber. They make you satiated. They slow down sugar absorption from the gut into the blood. So we always hear high fiber diets. Who hasn't heard about that? But it's so important for controlling caloric load on your body on a daily basis with your meals and sugar load. And so fiber is really where, if you really don't even want to think about all this stuff we're talking about, like really increase the fiber in your diet. One of the best ways to do that is with a whole foods diet. And I also want to say this to people because, a lot of the convenience foods out there now, or functional foods, are very high in fiber and can really, really be great for people. So there's some cereals out there that are just basically high fiber cereals, like seriously high fiber cereals that taste okay, and they're very satiating. One of them, we need sponsors for everything I mentioned here.
That's what I'm saying.
I know. One of them, it's an expensive cereal because it's a functional food cereal, but it's called Catalina Crunch, right?
Oh.
It's very high fiber. So anyway.
Catalina Crunch, the Catalina wine mixer. Do you know that reference, Keoni?
No, I don't.
I think it's from Step Brothers. It's a movie with Will Ferrell.
Okay. Well, there you go. So it has to be good.
Yeah, exactly. It's fancy.
That's right. But anyway, any functional food, like you see these high fiber protein bars or meal bars, those things will help. And a lot of them now are more functional because they have some of these starch blockers in them. Like I saw a bar the other way that had brown seaweed extract in it. So, these things can help.
Yeah.
So those are kind of acarbose and metformin are kind of the two prescription oral glucose lowering agents, right? But there are others. So I just want to go through these because they have very weird names and they're not really like go-to meds that you want to start on right away. It depends because they have side effects with them, but they're very common out there. So one of them is called thiazolidinediones, right? Okay, so can you pronounce that? The acronym is TZD. And examples of this are pioglitazone and rosiglitazone. And what they do is they increase insulin sensitivity and the activation of what's called PPAR gamma. And PPAR gamma is a nuclear receptor that basically you can think about it as a nutrient sensor that causes your genes to do certain things that can then help lower hemoglobin A1C, improve lipid levels. The other interesting thing about these meds is they may actually help preserve beta cell function. Beta cells are the cells in the pancreas that actually produce insulin. Also seem to have a mild anti-inflammatory effect. So what are the risks? Well, some of the risks include heart failure, heart attack, stroke, bladder, cancer, and then they also may cause weight gain in some people. So they're kind of like a secondary, tertiary oral medication treatment for type 2 diabetes.
Okay.
There are other meds out there called
Yeah, these words, it's like when you were, and I guess learning how to read in first grade or whenever that happened, and you would get, the cat jumped across, and then you got to the next word that was just this insane word you never seen before. That's exactly how these drugs look. Thiazolidinediones.
Yeah, I can't pronounce half of these, but anyway, the other ones are, there's a couple drugs out there called
They just stop you
glipofloxacin,
in their tracks. They
right,
just
and canagliflozin. These things cause glucose to be excreted by the kidneys. So you see how these all have different mechanisms. What they show is they also will lower hemoglobin A1C. They help with weight loss. It seems like they act like a diuretic, right? Because they're just trying to get glucose out of the kidneys, excreted by the kidneys, so you're peeing it out. So maybe a bit of a diuretic function there, so they can decrease blood pressure too. Anytime you increase glucose in the urine, you're more prone for UTIs, fungal infections, that type of thing. This is, again, anytime you have high sugar in your bloodstream, anywhere in your body, you're going to increase your risk for fungal infections. So this is another reason, one of the main treatments for somebody who has fungal infections and chronic fungal infections. Yes, definitely check for sugar levels.
interesting.
Since they act on the kidney, you definitely want to make sure that kidney function stays healthy and stuff. So there's been some associated risk of like bladder cancer with these drugs. I mean, it's minimal, but I want to bring it up so people know. So a couple other weird sounding names, a different class. They're called dipeptidyl peptidase 4. They're DPP4 inhibitors. These things, they basically prolong the action of GLP-1 and GIP by inhibiting their breakdown. So we talked about GLP-1 and GIP. They are hormones that are basically secreted from the GI tract that basically cause your body to not overeat. They have this satiating effect. They are low. They're been shown to like lower hemoglobin A1C. Also, there is a risk that they can lower your blood sugar a little bit too much.
Okay.
And so if they do that, they with these secondary drugs, all of these, there's more of a risk for having low blood sugar side effects and stuff.
Makes complete sense.
Yeah. Side effects, there's some association. It's very small with like pancreatitis or pancreatic cancer. Again, I just want to put out, just call out the serious side effects. For the most part, people do very well with these, but I just want to let people know. I think the common side effects are like, respiratory and urinary tract infections, some constipation. Um,
Yeah, that's
there,
interesting what you mentioned just about the glucose, like extra glucose in your urine, more bacterial infection or possible UTI, things like that. It's good
yeah,
information to know, especially in like a skilled nursing facility and that sort of thing.
right. Oh yeah, yeah. Um, let's see. There's a there's another class of drugs called sulfonylureas. These are called common names, or the drug names are called glimepiride, glipizide, and glypiride. I've seen these quite a bit in my practice, and what they basically do is stimulate insulin secretion. So you kind of see now. So we're using those oral glucose lowering agents, and now we're getting to the oral ones that stimulate insulin secretion. So this is kind of like a tertiary thing that the next rung down on the ladder that you would now go to if you can't control the sugar and the hemoglobin A1C and insulin levels, right? So now you use these oral agents. Again, very prone, people can get hypoglycemia with these. Again, that's why I really like metformin. Metformin doesn't do this to people, even though you should always check your blood sugar. It's been shown to lower hemoglobin A1C significantly, which is great, but comes with a lot of side effects. And then there's another class of drugs called glinides or meglitinides. And so, what are the common names? Repaglinide, nataglinide, again, stimulate insulin secretion like the sulfonylureas do. So, let's say we have our patient. We're trying to manage this. We're trying to manage lifestyle. Um, and it's not manageable, or they're not compliant, or whatever the reasons may be. Every patient is different. If none of this has worked, this is where you now start getting into your injectables, right? And insulin is the biggest injectable out there. I mean, that's it's the next go-to thing you want to try. And there's different types. There's rapid acting insulin and long acting insulin. It all depends on the patient and how far along they are, and what you would use for that. Now, we talked about insulin. Insulin is a growth factor, so you can think about all the side effects that may come with that, right? If you have insulin around, one of the reasons why diabetes makes you more at risk for cancers, the treatment in itself can put you more at risk for cancers. So that's like a double whammy. Not only do you have diabetes, which increases it, but now you're taking drugs that, like insulin, that certainly can increase it.
Right.
So you really, and there's other forms of insulin out there. There's an inhaled form of insulin out there, and they're finding that there may be some correlation. If you inhale it, you may get respiratory tract type cancers. There's some correlation with that, which is pretty crazy to think about. It's almost like in those last podcasts we talked about, well, if you're doing insulin and you're, all you're trying to do now when you're taking insulin is just manage the disease. Now, you can reverse and put people into remission with insulin, but you really want to catch people early to really get that done, because after a while, if the diabetes goes on for a while, it's really, really hard to reverse its negative effects and to control its blood sugar. It's almost like the body is in emergency mode and doesn't know what to do. I mean, it can't communicate with itself appropriately. So now you're using all these exogenous injectables to do that.
Mm-hmm, mm-hmm.
So there's another injectable I just want to talk about quickly that a lot of people probably haven't heard. It's called Simlin, or pramlintide, and it's an injectable drug that can be used along with insulin. When your pancreas secretes insulin, it also comes with a hormone called amylin. We don't really hear about that a lot, but amylin also has some glucose lowering effects, and this drug is just a synthetic form of that. So you can use these two together. They marry well together. And then there's the glucagon like peptide, the GLP-1 agonists. These things mimic those hormones, GLP and GIP, these hormones that are secreted from your intestines that help keep blood sugar and help keep metabolic regulation going well. These are just analogs to that. And again, it's an injectable. and these injectables all of these injectables are pretty much subcutaneous. So it's not like deep muscular injections or anything like that. So it's not, with these injections, it's not like, you're going deep into the tissue and increasing your risk of infections and all that may come along with injections. These are really minimal. They're subcutaneous.
Gotcha.
So, with GLP one agonists, again, you can increase your risk of pancreatitis and pancreatic cancer. These are basically called the incretin drugs for diabetes. So you have your oral forms of that, you have your injectable forms of that. So those are basically a rundown of the meds. One thing that I've seen throughout in the clinic is I've seen metabolic surgery or bariatric surgery do a tremendous amount of good for people. I mean, there's a lot of negative side effects with it, but in general, most people, if they are a candidate for this type of surgery, do very well and can completely reverse their diabetes with this. So this may be something that people want to look into, especially if they have a very high BMI. I think you're a candidate if you're diabetic with a BMI over 40.
Are these like, gastric sleeves and the bariatric surgeries we think about?
Yep.
Okay.
Any type of bariatric surgery, and there's a number of different ones out there, but it's pretty amazing too how this bariatric surgery affects the body. I mean, it's almost like overnight you reverse diabetes in people, and then it also seems to have we didn't really talk about this so much, but it also seems to have some type of a beneficial effect on your gut flora. And if your gut flora is healthy, that's a way to fight blood sugar issues and diabetes.
Both those points are really interesting. I can't think of why. So as far as when you say reverse diabetes overnight, because of they're intaking far less food or something more
they're definitely intaking far less food, but there's definitely a hormonal component where the body just shifts and becomes like, just a better optimizer of nutrients. Now, of course, you're not putting a lot into the system because you can't, and you shouldn't.
AKA fasting.
Yeah, so right. I mean,
back at square one, we've made a full circle.
Right. Yeah. But these surgeries, they're not completely understood how it can help reduce things. But, we've talked a lot with the diabetes stuff, and you're talking about a whole symphony of hormones and metabolic messengers that are just completely disrupted with high sugar levels. And in the beginning, you can control them very easily through, natural treatments, lifestyle, medications and stuff. But it's almost like metabolic surgery is almost like a reset for diabetes.
Okay.
But you have to be a candidate. You have to be a candidate for it, and you have to be in decent health for it, even though you may have a BMI well over 40 to be a candidate for it. The metabolic surgeries have good safety profiles, but yes, definitely problems can occur with it.
Yeah, aka 600-pound life.
Yeah,
everybody knows that show.
Right. One other thing I want to talk about are like the anti-obesity medications. We talked about some of these on a podcast way back when, but one of them is called lorcaserin or Belvic. It basically increases satiety and decreases hunger. Has some negative side effects, but it works by different mechanisms than just lowering glucose. It basically helps decrease your, they're considered weight loss drugs. So it basically decreases your intake of calories. And then the other one, that's a combination of phentermine and topiramate or Topamax. Both of these drugs alone can help people with weight loss and can help, with sugar control and hemoglobin A1C based on how they affect the brain for helping you control your intake. But a combination drug called Qsymia is both of these drugs in combination. So these are just some weight loss drugs. And then there's another drug out there called Orlistat, which is basically a drug that inhibits absorption of any nutrients, and it's because of its inhibiting absorption of fat, especially fat. Um, it can cause, diarrhea and all kinds of things. So it's these drugs, again, they're not without their negative side effects. It's really funny, that drug. I mean, I think I told you this before, but it's just funny reading the label on that drug, because in one form of it, or I forget what the name was called, is called Ally, I think it was. But you read the back of the label, and I kid you not, on the back of the label it said, bring an extra pair of brown pants because you may have anal leakage. So it's great. So I'm going to take a drug and have anal leakage. How lovely is that? And I got to take some brown pants with me too. It actually said that on the label, which is crazy to me.
I feel like you're lying, but you're not.
No, I'm not.
That is nuts. Yeah, that is nuts. If that is the case, that is very nuts.
So yeah, you want to try to avoid these things, avoid these meds if you can. With diabetes, it's very inflammatory. You get a lot of joint pain and everything like that, arthritic pain with diabetes, just because of the sugar. That non-steroidal anti-inflammatories can help control that. When you feel better and you don't have joint pain, this more than anybody, Brian. I mean, if you're in pain, you don't want to move. If
Right.
you're not in pain, then you do want to move. And then once you start moving, it creates this positive cycle of more movement. But once you stop moving and are in pain, it creates this negative cycle of no movement. No movement, you don't have a blood sugar sink, right? So I consider anti-inflammatory agents part of treatment with diabetes. My favorite ones that are not drug-based or over-the-counter based are, curcumin is probably my favorite as a good general broad-acting anti-inflammatory. But things like fish oil can also help. So there are other things out there on the horizon, like stem cell therapy. These things are really phenomenal because they may really help they may help your body build up its your pancreatic beta cells. And that's really what we want to do. As diabetes gets worse, you basically fatigue your pancreatic cells or destroy them where they don't work. So stem cell therapy can basically replace the broken parts. So that's really cool, if we get there.
Yeah, absolutely.
So anyway, there are other things out there, but I mean, I think we've gone over most of what I wanted to go over for this.
Most effective things being diet and lifestyle.
That's the most effective thing. Yeah, you don't want to get to the place where you have to have like insulin pump implants or injecting yourself every day and so on and so on.
Yeah, you don't want to be taking notes on this episode. Maybe on episode 1 and 2.
Yeah. Let this episode put the fear in you, so you never, and not that fear is a great motivator, but education is a good motivator. So hopefully we can educate people and just help people with the situations that they're in, and also help people with their loved ones.
Yeah, absolutely. Great point. Anything else, Keoni?
No, that's it. I think we hit on everything we wanted to.
Does this wrap up? Is this the 3-parter trilogy?
This wraps it up, but it's very interesting to me how a lot of our podcasts always come back to sugar levels and keeping that under control, chronic disease, all that. I mean, diabetes is a epidemic, especially in the Western world. It's an epidemic. Even in the third world, it's an epidemic. So we really want to do our best. I mean, right now we're going through this COVID pandemic. People with diabetes have a really hard time fighting COVID. So, it has disastrous results on your immune system too. So
that was that extra fear of God, little
cherry
on top.
I prefer to call it education.
Fair enough. I'm sorry. All right, everybody. Thank you for listening. We will talk with you next week. And until then, be well.
Thanks, everybody. Bye.